Hello, I'm Jordan Greenbaum. I'm going to spend the next few minutes talking about trauma-informed interviewing techniques. We'll review some of these strategies you can use when you're speaking with children and caregivers who have experienced a great deal of trauma in their lives. While this webinar is created specifically for Project Lifeline's Predicate Order Resource Center, the information actually has relevance for lawyers interviewing children seeking other legal remedies, such as asylum and withholding of removal. I'm hoping that by the end of this very short presentation, you'll be familiar with the ways that trauma impacts a person's views, their beliefs, and their behaviors. That you'll recall the key components of the trauma-informed approach and be familiar with some concrete ways to incorporate trauma-informed care into your work. The relationship you build with your child client determines your ability to assist in providing critical assistance and improving the life of the child and their family. To do your job, you need to obtain detailed and accurate information about the child's past, some of which may be sensitive and difficult to discuss. While there are many ways to approach your interview, use of a trauma-informed approach is highly recommended and is becoming a best practice in many areas of child service. The Substance Abuse and Mental Health Administration Services designed the trauma-informed approach as a strategy to use when interacting with any adult or child who has experienced significant trauma, be it loss of a loved one, major illness, an injury, violence, abuse, or exploitation. The goals of trauma-informed care are to facilitate a trusting relationship with an individual so they feel safe enough to discuss issues that are important to them and to share their vulnerabilities and needs. While practice of a trauma-informed approach may lead to a child disclosing abuse or neglect or exploitation, disclosure is not the underlying goal. Rather, the goal is to identify and assess the child's needs so that you as a professional can offer emotional support and services. There are several key components of trauma-informed care. A trauma-informed professional recognizes the impact that trauma has on the life of an individual and responds appropriately, taking steps to minimize any re-traumatization. They strive to foster a sense of physical and emotional safety in a child. They show respect for the child and their experiences, emphasizing resilience and striving to empower the child using a strength-based approach. With the trauma-informed approach, one understands the impact of trauma on individuals, families, groups, and communities. That is, one realizes that trauma may cause stress that manifests itself in a variety of ways involving physical, emotional, and behavioral domains. A traumatized person may adopt behaviors, views, and attitudes that serve to protect them from a hostile situation. Some of these attitudes and behaviors may be maladaptive in situations outside of the trauma setting. For example, drug use, hostility, and aggression. They may also negatively impact others who interact directly or indirectly with the victim, including child-serving professionals. A migrant child who has experienced ongoing stress, trauma, and uncertainty may come to view the world as a dangerous, hostile place in which everyone, including you, seeks to exploit them and cause them harm. They may be wary and suspicious of others, may misinterpret neutral facial expressions as angry, may view themselves as weak and bad, expecting others to shame them. A trauma-informed attorney recognizes this and maintains an open, non-judgmental, empathic attitude when working with a child. Trauma-informed care is victim-centered. That is, the best interests of the child drive all decisions, activities, and goals. As professionals working with migrant children, we all have specific roles and responsibilities. We have our own lists of tasks that we need to complete. However, our desires and plans must yield to the child's best interest at any given time. And whenever possible, we need to respect the child's wishes. Our plans for assistance may not be appropriate at certain times, and the needs of the child require flexibility on our part. Trauma-informed care takes a human rights-based approach. The United Nations Convention on the Rights of the Child identifies key conditions to which all children are entitled. Here are some of the rights particularly important to your work to provide immigration relief. As your client, the child has the right to be given relevant information and in a developmentally and culturally appropriate manner. They deserve to know what you want to do and why you want to do it. They need information about the risks and benefits involved in the decisions they make. They have the right to express their views and be heard by those who are attempting to serve them. We need to stop and listen to the child. That child is an expert on themselves and may have critical information that we lack. Your client has the right to privacy and confidentiality, and very likely has major concerns about both. These need to be addressed early and completely. A child will not talk of their fears and vulnerabilities if they do not trust the listener to respect confidentiality. Your child client has the right to dignity and self-respect. Further, they're entitled to respect of their cultural and religious beliefs and practices, as well as their special needs. They have a right to acceptance and tolerance of their gender identity, sexual orientation, and political views. And they deserve respect for their perspectives on family, intimate partners, and on their situation. Earlier, we spoke of the need to establish a sense of physical and psychological safety. This needs to occur throughout your meeting with the child, from the moment you introduce yourself to the time they leave your office. Physical safety may be addressed through routine environmental conditions, such as locked doors and alarm buttons. Psychological safety is more challenging. So let's see how this works. Let's say that Clara is your next client. 16-year-old Clara has come to the United States from Guatemala. She has a known history of sexual abuse by her father and death threats by a local gang. En route to the U.S., she was kidnapped by a gang and held for ransom. During her confinement, she was sexually assaulted. She arrives to your office with her uncle. You have no idea who this uncle is, so we cannot assume that he has Clara's best interest in mind. In obtaining information for Clara's case, you need to ask sensitive questions, and it would not necessarily be safe to do so with this uncle in the room. So you need to separate Clara from her companion. Let's say you introduce yourself in the waiting room, and the uncle stands up and says, "Come on, see, let's get this over with and get out of here." He obviously intends to come with her to your office. What do you do? Well, you may calmly explain that it's standard practice in your office to interview your clients alone at the start of a visit. He's welcome to read a magazine here in the waiting room, and you'll be glad to speak with him individually or with Clara later in the visit. You make it clear you're interested in his point of view and his questions, but first you need to speak with your client. You're not singling him out for special treatment. This is your policy and practice. Okay, you get to your office. Now what do you do to make Clara feel comfortable, safe, and empowered? You may begin by giving her a choice. In this way, you're empowering Clara. You might say, "Please sit anywhere you like, on the sofa or either chair." You introduce yourself and ask what name she would like you to use for herself. You attend to her basic needs, maybe by saying, "Are you thirsty, Clara? Are you warm enough?" You explain your role using easy-to-understand language. You acknowledge the possibility that Clara may be feeling anxious about the visit and potentially worried. So you might say, "You know, I meet with lots of teens like you, and many come here feeling pretty anxious, not knowing what's going to happen. What have you been told about this visit today?" Or, "What were you expecting from this visit?" Or, "How were you feeling during your trip over here?" You maintain good eye contact, assuming it's culturally appropriate for Clara, and you show concern. You acknowledge her discomfort and empathize. "What would make it easier for you to be here, Clara?" Then you may go on to ask Clara if she would like you to explain what usually happens in visits like this. In this way, you're giving her control, you're sharing knowledge, and you're seeking her consent. Clara says yes, she'd like to know. So you go on to explain the usual process, making it clear that you're not assuming that Clara will or should agree to cooperate. You engage and empower her by saying, "I've just given you a great deal of information. Do you have any questions about what I've said?" Because children may be reluctant to acknowledge confusion, you could say, "Sometimes I feel like I'm not as clear as I'd like to be. Would you please tell me how you understood what I've just said?" You might go on to ask, "What would you like to see happen during our visit today?" To build the trust Clara needs to feel comfortable sharing her prior experiences, you need to take time to build rapport. This is not something that occurs once at the start of the session and inevitably requires a long period of time. It may begin with a mere 5-minute chat about what Clara's weekend was like, how she's been feeling about being in the United States, what she likes best about her new life. You ask open-ended questions. You actively listen, occasionally saying, and aha, I see, and refrain from interrupting or challenging her perspectives. But rapport building does not stop there. It continues throughout this and subsequent sessions, with occasional breaks in the intensity of your work to take time to engage in informal and easy conversation. As part of building rapport and establishing trust, you need to anticipate situations in which Clara may experience the anxiety, fear, and distress she felt during prior trauma events. Take a minute to think about each step of your visit with her. What will Clara see when she walks in the door? With whom will she interact? What types of questions will she be asked? Will she need to complete various surveys or assessments? Will she need to participate in any other procedures? When you speak with her companion, where will Clara be and how might she experience this? Try to determine whether any of these micro-experiences may trigger Clara to feel threatened or coerced, vulnerable or ashamed. Are there any points in the process in which she may feel out of control and uncertain of what will happen to her? If so, she may begin to experience the same feelings she had during traumatic events in her life. She may be re-traumatized. You need to avoid this if at all possible, and if not feasible, you need to minimize the impact. How do you do this? Well, using a trauma-informed approach, you can address many of these potential triggers. If you consistently provide explanations of what you want to do and why you want to do it, Clara will feel less uncertain. If you consistently seek her consent for each step of the process, she'll feel that she has a choice and some control. She won't feel threatened or coerced. By showing respect and empathy, by listening more than speaking, and by accepting Clara's perspectives, you minimize the chance she'll feel ashamed. By offering choices, asking her if she has questions or concerns, and frequently seeking her opinion, you reduce her feelings of powerlessness and vulnerability. Well, Clara finally begins to talk to you, and you establish rapport. Now you're ready to transition to questions surrounding the SIJ application. But before you start, what are you going to say to demonstrate respect, provide explanations, obtain consent, and maintain transparency, which are the 4 key components of trauma-informed care? Well, you might begin with something along these lines. Clara, I'd like to ask you some more questions now so I can get a better idea of how I'm best able to help you. To do this, I need to ask questions about your life. Some of these are general questions, but others are pretty personal and may make you feel uncomfortable. You go on to explain how you will use this information and stress that you will only ask for information that is relevant for your work to help Clara. Emphasize that the documentation status of people in Clara's life does not influence the SIJ process. If these are forms for Clara to fill out or assessment surveys, explain these and show Clara the forms. Then you may say, I've explained what typically happens, but you're in control here, Clara. You decide what you want or don't want to do. You can answer some questions and not others. You can write or draw your answers instead of talking. You can decide you don't want to go through with the process. It's up to you. Before asking for Clara's consent to begin with your questions, be sure to discuss how this information is to be used, documented, and stored. Who has access to this information? Clara needs to know the limits of confidentiality so she can decide what she wants to disclose to you. Again, the right to information and informed consent are critical. If she asks you not to document certain information, discuss her concerns about that. What worries her about this particular information being shared? Then work to accommodate her wishes if possible. If you cannot keep the information out of the records, be sure to explain why and work with Clara to explore ways to minimize the potential negative impact. Now, what if you're thinking, I can't give her a choice whether she answers questions. She has to answer my questions. Think about it. If she doesn't trust you, she may answer you, but not honestly. Then you get the wrong information, which may complicate your work, cause you much more work, and can even derail your efforts. Instead, consider building more rapport and/or interviewing at another time. It takes time to build relationships, so good interviews may not come for a few weeks. Before you get far in your interview, you want to establish certain ground rules in order to maximize the accuracy of the information you obtain and minimize Claire's discomfort. So you may review certain conditions with her, such as the importance of Claire telling you when she doesn't understand your question. You're glad to rephrase it, or when she doesn't know the answer. If she decides to talk about her experiences, she needs to only talk about what has actually happened, what she knows, rather than what she thinks may have happened. In turn, you'll do your best to ask your questions in a way Clara can understand. You'll refrain from interrupting, and you'll ask Clara for clarification if you don't understand something she's said. Just like Clara, you'll say, "I don't know," when you don't know an answer. I hope these tips on trauma-informed care are helpful to you in your interviews of children and caregivers. Many of these you may already know. Others may be new. But hopefully all will become part of your repertoire and help you assist your clients in building a successful life in the United States. Thank you.